All right, so this video is going to be about a modern protocol which is known as the ERAS protocol or ERAS protocol. So, early recovery after surgery. So, it's a multidisciplinary protocol first and foremost, right? It's a multidisciplinary protocol, so it is peri-operative, meaning it takes action before the surgery, during the surgery, and even after the surgery. It can involve surgeries like, for an example, orthopedic, bariatric, colorectal, and there are different surgeries, hepatobiliary. So it transverses a lot of specialities, right? Surgical specialities. So how? So what is the aim of this? I mean, when something is put, you have to always question what is the purpose of it. So the aim of this is to reduce the infection risk. First of all, improve recovery, as the term itself, improve recovery, reduce the infection risk, uh, reduce the mortality, reduce the readmissions. So all of these things is the predominant aim of this protocol. And as far as if you're talking about MRCS, there's an important measurement like a 30-day readmissions. So this is one thing that can be asked, which I came across as being one of the important parameters for like evaluating this. So that's one. And yeah, so like I said, this is peri-operative, so it can start even before the surgery itself, during the surgery, and post-surgical. So how does it exactly look like? So pre-operative. So pre-operative in the sense it begins with patient education. The patient is educated on the procedure. The patient has to know pretty much what is going on. The patient is counseled, and it has to be told. The patient has to be aware of what is going on. So that is one. And then proper, comorbid optimization, and there's always the best for unnecessary. It's best to avoid unnecessary bowel preparation, and most of the nail by mouth is not just simply after midnight. You usually 6 hours of foods before surgery. Like, I mean, it has to be 6 hours from. You can have your food like 6 hours prior to the surgery time. Then 2 hours. I mean, if it's 2 hours prior to the surgery, you can have some clear fluids, and not after that, right? So 2 hours of strict fasting is a must anyway. And preparations, bowel preparations, anyway, it has to be specific. Certain surgeries do need bowel preparation, so again, those things are specific, but the aim is to reduce unnecessary fasting and discomfort, right? So now come intraoperative, right? So now intraoperative, what's going on? So your incisions, so from a surgical point of view, your incisions are going to be minimal. You don't want to make too much of a large incision, so minimal incisions, and also with minimal opioid usage. So you have different options: local anesthetics, and you have to be in contact with the anesthesia team to optimize how this use of opioids is to minimize the use of opioids. Yeah. So that is your intraoperative. Again, antibiotics and all those things will also come in there. So now come to the post-operative. Post-operative, again, important thing is early mobilization. Uh, so early mobilization, what it does is it reduces your risk of DVT, deep vein thrombosis, infection risks secondary to like pneumonia, those things. So it reduces the risk of those infections. Mobilization, yes. So that's all. So early mobilization reduces the risk of those things, infections, and right. So it allows them to obtain functionality much quicker. So that is one. Then feeding. So it depends on the surgery. Really. If it is GI surgery, sometimes you have to look for. You can start within 24 hours. Again, this is not strict. This is based on the surgery itself. Orthopedic, sometimes you can work up, right? Post surgical, you can work up, meaning sips of water, then soft diet, then your normal diet. Like, you can work yourself up. So that's, and yes, and pain management. Yeah, this is again, we don't want to use a lot of opioids, right? With the action of the central nervous system, you can go with the paracetamol, non-steroidal anti-inflammatory drugs, and other examples. So yeah, This is basically the enhanced recovery after enhanced or early recovery after surgery. So this is basically the protocol.